When you think of the word compliance, what comes to mind? Do you think about following the speed limit on your drive to work in the morning? Or perhaps making your children mind? Or do you run for the hills when you hear that word because you have visions of someone else running your practice? Hello, my name is Linda Harvey. I'm the founder and Chief Knowledge Officer for the Institute for Dental Compliance and Risk Management. Welcome to this short video tip where we'll talk about 5 common denominators in every area of compliance. As you can imagine, we all think of compliance a little differently. Yet before we speak about those 5 common denominators, I'd like to share the fact that compliance brings 3 common elements to every practice. First are structure and processes. Let's take scheduling, for example. Can you imagine if every member of the team was scheduling their patients differently every day of the week? Or sterilization is another example. What if every clinical team member was conducting the processes for disinfecting, decontaminating, and processing contaminated instruments differently? What chaos you would have in your office. What risk. So the second core element is safety. Compliance brings safety for patients and for team members alike. After all, what dental practice doesn't want to be known for providing care in a safe and trusted environment? Well, the third common element is the fact that compliance protects your assets. It protects your business, it protects your license, and it protects your reputation. All 3 key areas of importance. Well, in thinking about how do we address compliance, whether we're talking about infection control, OSHA, HIPAA, corporate compliance, or even HR, there are 5 common denominators. First and foremost are the standards and the laws. Do you have copies of the current standards in your office? Now, granted, some of the standards, such as HIPAA, may be rather onerous to print out a 500-page law, but do you even have summaries of those laws? Over the years, I've been very amazed at the practices that we've worked with and asking and seeking if they follow the CDC guidelines. And they all say, absolutely, we do. But many offices don't have a copy of the CDC guidelines in their practice. And I'm not talking about the interim guidelines from last year because they were a moving target. I'm thinking of even just the 2003 infection control guidelines from the CDC. So having current copies of standards is pertinent in your practice. Otherwise, how will you know what you need to follow and what you're obligated to do? Second is assigning an individual to be in charge of that role, whether it's your safety coordinator or infection control coordinator, your HIPAA officer, or your corporate compliance officer. Once you've assigned a team member to that role, what kind of support do you give that individual? Are they afforded additional opportunities for training so they can be competent and feel confident they're doing the best and accurate job for your practice? Third is customized policies and procedures. Policies and procedures are very much like your patient records. If they're sitting up on a shelf gathering dust, they're not serving your practice. And those patient records are updated on a regular basis, aren't they? They're a living, breathing document that tells us about all the care and the continuity of care you provided to your patients over the years. Policies and procedures should be the same way. Fourth is that they need to be reviewed and updated on a regular basis. Usually that's done, say, annually, for example. That's a great opportunity to just take those binders off the shelf, dust them off, and make sure they're current. Hopefully you're referring to them throughout the year anyway, and they're not dusty. So customized policies and procedures also serve to protect your practice. You see, if there's an allegation by a patient, or you have an audit or some type of inspection, every attorney, every auditor, every inspector is going to ask you to produce those policies and procedures. If they're sitting on a shelf they're sitting on a binder on the shelf, were they even filled out? Have they been customized for your practice? The 5th common denominator relates to training. You see, I've placed that last, even though many offices place that first and think of it as a checkbox to complete every year. And when we do that, we forget all these areas that we just mentioned. Yes, by law, we have to provide our new team members training upon hire and training annually thereafter. And that's a key factor, but that training also has to consist of the content in your policies and procedures, and an orientation to your practice so they understand how HIPAA is effective in your practice and what are those processes, how sterilization carried out in your practice, for example. So together, those 5 elements cross all areas of compliance, whether we're talking about infection control, OSHA, HIPAA, corporate compliance, or HR. These 5 common denominators can be used throughout your practice. So stay tuned for future blog posts where we'll delve a little bit deeper about some of the new changes that have just happened with HIPAA and those laws, as well as corporate compliance and what that means for your practice. In the meantime, I hope you'll take a look at the resource guide that accompanies this post to help you take back these 5 common denominators and apply them to your practice.